Try, come on by, pretty please, with sugar on it. That's how I like it. Ooh, I can't even believe it with you. It's like having every dream I ever wanted. I picked up your vibes, you know it all. My vibes, I'm still dreaming. Yeah. Found you right where I found you. Oh, baby. With my arms around you. Oh, baby. If only you believe like I believe, baby. Like I believe we can buy. If only you believe, if only you believe in miracles, so would I. If only you believe like I believe, baby. Like I believe we get by. If only you believe in miracles, baby, miracles, so would I. So would I.
Good afternoon, and thank you for joining us for our first ever webinar featuring the inspirational chief nursing officers from across the Mount Sinai Health System. Today, we will be sharing Mount Sinai Nursing's lessons learned on the front line during the COVID pandemic. You will hear from our nurse leaders on how they adjusted to the demands placed upon them and their teams, and how nursing teams mobilized to the outbreak. As you know, the COVID pandemic, which began at the beginning of March, changed the landscape of New York City. For many of us working in healthcare, even though the situation was stressful, we went into the flight or flight response, rolling up our sleeves to take care of the critically ill patients that came into our hospitals. Although the virus had devastating effects on life, economics, and the overall landscape of this city, the silver lining of this whole experience is that it caused people to pause and appreciate each other and our teams. During this time, we exemplified the Mount Sinai Health System value of teamwork in our fight against COVID-19, working on units other than our own, working with different people and different teams that we may not have known before March of 2020. We pushed away titles and our focus was solely on our patients. I am incredibly proud as Chief Nurse Executive of the unique role that nurses and advanced practice providers played in the COVID-19 fight. And today, we have the privilege to hear more about these efforts and experiences from our esteemed Chief Nursing Officers at the Mount Sinai Health System. Please join me in welcoming. I will introduce myself. My name is Beth Olive, the Chief Nurse Executive and Senior Vice President for the Cardiac Services at the Mount Sinai Health System. We have Fran Cartwright, Senior Vice President, Chief Nursing Officer for the Mount Sinai Hospital. Stacy Conklin, Senior Vice President and Chief Nursing Officer of Mount Sinai South Nassau. Claudia Garcino, Vice President and Chief Nursing Officer of Mount Sinai Brooklyn. Goldstein, Vice President and Deputy CEO of Mount Sinai Queens. Christine Mahoney, Senior Vice President and Chief Nursing Officer of Mount Sinai Beth Israel and Mount Sinai Downtown. Wendy O'Brien, Vice President and Chief Nursing Officer of Mount Sinai West. Zena, Vice President and Chief Nursing Officer of Mount Sinai Morningside. So Jill, I'm going to start with you, please. We know that 2020 is the year of the nurse, and it's been in every sense. What do you think the history books are going to say about the COVID-19 pandemic and nursing's tremendous role in caring for COVID patients?
Thank you, Beth. When the World Health Organization declared 2020 to be the year of the nurse and midwife, in celebration of the 200th birthday of Florence Nightingale, across the globe, many organizations, professional associations, and the Mount Sinai Health System were poised to affirm this theme and celebrate the many roles and contributions of nurses in advancing the health and welfare of people in every nation. On March 10th, 2020, the WHO declared the coronavirus outbreak a pandemic. This call sent a message that everyone has a role in actively preparing and preventing further spread of the virus and seeking ways to protect the most at risk. This type of call to action was not new to nursing. Throughout our history books, for instance, in 1918, during the disastrous influenza pandemic, nurses were steadfast in modeling the teachings of Nightingale, a staunch supporter of good hand washing, proper sanitation, and sound preventative measures. Subsequently, the nursing profession has played major roles in stepping into times of crisis and providing care and innovation that has saved so many lives and reduced suffering. Serves Frontline Premiere during some of the world's most recent infectious outbreaks, including the H1N1 swine flu, Ebola, severe acute respiratory syndrome or SARS, and the Middle East respiratory syndrome MERS. This brutal COVID-19 will be no different. From providing direct care to affected hospitalized patients at Mount Sinai Hospital System, our nurses were front and center, working around the clock to protect the health and well-being of patients and the public at large. While public health nursing had traditionally been recognized for efforts during these times of public health crisis, now nurses in acute care settings were applying evidence-informed public health principles to prevent disease and care for some of the world's and cities' most sickest patients and hospitalized patients. Textbooks today will demonstrate nurses are leading response teams demonstrating skill and expertise in areas such as disaster preparedness, predictive modeling, hospital operations, and human resource management, just to name a few. We're very proud of nurses everywhere across our Mount Sinai Hospital System as they provided services during the current pandemic. An overwhelming majority of U.S. nurses have never dealt with anything of such magnitude during their nursing careers. In fact, it's probably more accurate to say that none of us have. Any progress in combating the COVID-19 virus would cease to exist without the expert and compassionate care of our Mount Sinai Hospital System nurses. Nurses will always be on the front lines, caring for the world at large, way beyond our current global pandemic. Nurses' presence is a real cause for celebration, both during and beyond the Year of the Nurse and Midwife.
Thank you, Jill. Next question, Fran. People are aware of the role nurses play on the front line of this pandemic. Tell us a little bit about how nurses are leading in the COVID-19 response.
Thank you, Dr. Oliver. During the COVID-19 pandemic surge in New York City, the fear was real, but it didn't hinder our nurses' courage, agility, and singleness of purpose to keep our patients safe and to provide the best quality of care possible. Every day, as the number of very acute patients continue to grow, our nurses put their personal needs aside to be at our patient's side 24/7. It was the nurse who delivered complex care with a finite number of staff while addressing patients and their families' response to the resulting physical, psychological, emotional, social, and spiritual aspects of care, the whole patient. As directives from the governor prohibited visitors from coming, our nurses became family to our patients. And this was during what may have most likely been the most stressful time for our patients, our staff, and families. Through the surge, nurses identified both practical and innovative ways to be there for patients and family. I look forward to providing some very inspirational examples a little later in the presentation demonstrating how our nurses led through the COVID-19 surge. Working collaboratively with interdisciplinary teams and the support teams, they quickly changed staffing models so that they could support nurses who had an extended nurse to patient assignment. They changed workflows to provide care to patients while keeping staff and patients safe. And they did this with agility and confidence that comes from an intuitive know-how garnered as professional nurses, because this is what nurses do. We've been taking care of our most vulnerable patients here at the Mount Sinai Hospital since 1852, but we had never faced a crisis like this before. Yet our nurses transcended the monumental challenges that COVID-19 presented. The remarkable contributions to this transformational work now continues to inform our future. So we knew that Mount Sinai nurses were remarkable before the COVID surge, but the surge heightened awareness of the work that now continues to inform and transform our care delivery. To keep a promise to our patients, we will keep you safe and we will provide you with the highest quality care and caring. For decades, the Gallup report reveals that nurses are the most trusted profession, but since COVID-19, the public now sees the power of nurses and what we do. As the world watched our nurses do this work as only nurses can, they continue to bring honor to their families, to the Mount Sinai Hospital, to the Mount Sinai Health System, and to the profession of nursing. Thank you.
Thank you. This question is for whoever would like to take it first. We've gone through something in our lifetime that we have never experienced before. How has this changed you as a nurse leader?
So my name is Maria Vizina. I'm the Chief Nursing Officer at Mount Sinai Morningside. When I read this question in preparation for this panel, the first thing that came to my mind was I had never experienced such a deep empathy with my colleagues as I did during this experience. You know, when you round and you talk to your nurses and you can see the visual fear in people's eyes, there is a connection that fear brings you closer like no other emotion. And to this day, I can even name some of the nurses, and not all nurses, by the way, where that experience kind of really sears through you. And also the valley and the highs and the lows of days of triumph and days of tragedy. I don't know that I've ever experienced such a gap in those experiences. And that there was no more weekends, there was no more weekdays. And that really changed the way you just thought about your mission. You really were coming in every day with a mission. It clearly was not even a position or a job anymore. And I never would have dreamed that I would have developed a sense of interdisciplinarity with my team members. It's like being in a bunker. It's like being in war. You're in one room in the incident command center with the same members every day, morning, noon, and night, 12, 16 hours a day. And you get to know people in ways that you never knew before. And I think this experience has left me with much more appreciation for the humanity of the people that I work with. And that's how COVID has changed my life.
I agree, Maria. I think that the titles went out the window.
Yeah.
It was that interprofessional collaboration and really just the importance of the teamwork and the agility, and just to see what people did. It was truly, truly amazing.
And people did recognize this is what nursing can do. This is, you know, nursing really did take a forefront in a way that I have never witnessed. And I've never been in an incident command for longer than a few days. This was 4 months. So that experience does change you forever.
And Maria, it's Stacy Conklin. I would add what you mentioned about rounding and the fear in everyone's faces, and sharing the fear with them was really important. I shared with them that I was afraid as well. We were in it together, and not that I was, you know, somewhere else that not acknowledging or feeling like we got this, no problem. No, we were all afraid, and acknowledging their fear was so important for them as well.
It's Fran. You know, I just listening to Maria and to Stacy, I just felt such a renewed sense of purpose and really a gratitude for the work that we're able to be here to do, and to be able to support our nurses and the rest of the team to provide this care for patients, and to see, I have such pride and for the nurses and for the work that they did, where they, you know, it's like so many times we heard, nobody signed on for this, but this is what we do, and they certainly did step up and do it.
Great. Okay, our next question is for Christine. At the beginning of the pandemic, when we were originally beginning our conversations about COVID and the governor talking about the potential surge, what was going through your mind? And how do you think that COVID would impact Mount Sinai downtown? And how did that compare to what you really experienced in reality?
I believe at first we were very concerned in terms of the levels of PPE. We wanted to make sure that we had enough. We wanted to make sure that we had the right PPE. We were getting directives from the Department of Health and the CDC. We wanted to make sure that the staff were protected. I think we were concerned where we would staff into what areas of the hospital. We've had several inactive units, and we didn't know into which of those we would first go into. And then, of course, to make sure that we had not only enough staff, but the staff properly trained to care for those patients. Also, we were concerned with, did we have the right equipment? We were hearing that patients, there was a lot of use of ventilators. There was also a lot of patients were in renal failure. So we wanted to make sure that we had enough dialysis machines. We wanted to make sure that the staff that we had were safe. And I think our concerns were to allay the fears of our staff who were going home, because again, we were learning things every day, and we were making sure that we were rounding and we could cover our staff in instruction on the new procedures that we had to implement clearly every day when we were starting to discuss that. I think how I thought it would impact downtown, I knew that there would be changes in perhaps workflows. I thought that we would see changes in perhaps the model of care delivery that we were with, how we would do for some of our patients. There would be some changes in operations and the demands on the staff. You know, I don't think we knew that there would be demands, but we didn't realize how strong those demands would be on the staff and the toll that it would take on the staff. I don't think we knew at the beginning how our staff would react with their emotions and how we would start to see those reactions months later. I don't think we were prepared for that. And I know that now through rounding, making sure that we're increasingly visible, we're trying to show a supportive presence to our staff so that we can manage some of almost like PTSD symptoms that we're starting to see with the staff. And I don't think we were prepared at the beginning for that. And I think going forward, if we were to surge again, I think we would be much better prepared to manage our staff at the end.
Thank you, Christine. This next question is from Maria. Mount Sinai Morningside is known as a lean hospital, utilizing continuous process improvement in numerous aspects of day-to-day operations. Your team has worked for many years on creating standard work. How did utilizing lean and continuous process improvement help you during COVID?
Good question, Beth. Lean, just so everybody understands, is not an acronym. Lean is a process improvement methodology. And why lean? Why do you choose lean over others? It really creates an intense focus on structure and process. But the unique thing about lean is that you must utilize, and you should utilize, the skills and the knowledge of the people who are going to perform the work. So that is really key to lean. So, and also, if you have standard work, which is really the result of the lean process, PDSA, then you ensure that the work is consistent from shift to shift, from person to person, from unit to unit. So nothing can be more critical or important in a crisis than having standard work, because it's the only way you can evaluate how things are moving. And we have to evaluate in a fast-paced, laser way, because now we're dealing with a crisis. We don't have weeks or months. But if everyone's doing something different, you don't really know what you're evaluating. So every time we came up with an idea, we would come together, meet in the lead lab, safe distancing, always included people, representation of people doing the work, and would come out with an idea written step by step, and then we would implement it, but we would always pilot it, even if it was for a few hours now because we're in a crisis, before we would go house-wide. And so we were very instrumental in using Lean when we had to create the surge ICUs that we needed that never existed before. And so with a lot of thought and ingenuity from IT, from nurses, from the Lean Lab, we took Google Nest, accompanied it with iPads, and were able to put it together in a very structured way outside the room because there was no line of sight in these med-surg rooms that we were now turning into ICUs. So there's the way the nurse could constantly look at the monitor, and there's a way that the nurse could look at the patient and be able to do it in a consistent manner from shift to shift. We came up with the PPE Go bag so we could protect our rescue teams that would come during codes to make sure that they were protected before they went into the room. And another example, I know for my own self, the amount of death that we were surrounded with was really at the highest levels than anyone had seen in their career. And so, although it was happening, hour after hour, we needed to come up with a very, very surefire way of managing the decedents, because something that we had never had to do before, when you average maybe 2 codes a night and maybe several deaths a week, you are now tripling and quadrupling that number. So we also use the Lean process to come up with standard work to manage our decedents. And I think, the other thing is it gave some sense of security to the staff to know that there was this intense structure and process in place. And we were just not kind of throwing ideas at people. And it always really, really makes a major difference when the people doing the work are then involved in creating the work, because they are really then your best champion, rather than anointing a champion who doesn't have any clue what the process is. So I was particularly engaged, with Lean, probably more than I had ever done before. So not that I wasn't converted, but I was triply converted during COVID. Thank you.
Thank you. This next question is for Wendy. Wendy, across the health system, we saw such great teamwork amongst interdisciplinary teams during the height of the COVID pandemic. Wendy, can you talk a little bit how you utilize diverse teams of nurses and advanced practice providers to help with critical care coverage at Mount Sinai West? And how did you implement just-in-time training programs to ensure that these teams had the tools available to take care of this patient population?
Beth, thank you. Thank you. I'm sitting here listening to my colleagues speak, and it is so, really just hits home everything that was done. It just brings it all back to mind and really moves you emotionally. We were really surprised. I mean, on March 7th, we literally took in our first patient. And that to us, that on that day, we had no idea what we were facing. We have 33 beds of critical care ICU beds here at West. And for all intents and purposes, we thought, okay, that should be it. That should be all I need. But unfortunately, we learned very early in this, and I think right around March 18th, when we were at about 90% of our existing ICU capacity, we realized the need for additional beds. And we stood up our then recovery, our PACU unit. And initially we said, although we can house about 26 patients in our PACU, we would only stand up 18 beds. Who would have known that those 18 beds would be very quickly filled, and that the resources available, critical care nurses, our intensivists, would be strained. We had to take a look at our advanced practice providers, our CRNAs. They stood toe-to-toe with our anesthesiologists and our ICU nurses. And they gave us a level of commitment, dedication that we although we knew nurses had it in them, we were pleasantly surprised. They took over the PACU and they ran that PACU day and night. And for many of those nurses, it was in fact that it was a commitment to 24 hours a day. They stayed and they worked along with our respiratory therapist, our anesthesiologist, our ICU nurses, and every hand in ancillary services that were available. They were there to provide respiratory care, to intubate and assist with intubation when necessary. Where we fell short, where we needed additional support, we reached out to our educators. They made sure that if a med-surg nurse needed to know the basics of mechanical ventilation, that they had that training. Where they needed support on how to handle critical care equipment, supplies, they received that right on in-time training. Our educators also, another resource that we value so much, and truly, we can only make these statements today, but we truly can't bring you to actually see the work that was done at that time. But without hesitation, they were there. They were there 24 hours a day. So I can't, I heard my esteemed colleague talk about the bravery shown and the commitment shown by nurses, but those extended not just to our staff nurses, but to our advanced practice providers. And there are no words to talk about what was demonstrated on our critical care platform for these individuals. Again, our heart goes out to them.
Absolutely agree, Wendy. This next question is for Claudia. Claudia, Mount Sinai Brooklyn is a community hospital where many of your employees are part of your community. Brooklyn was hit incredibly hard during the COVID pandemic, and many of your employees got sick. Given all that has happened, how is Mount Sinai Brooklyn team doing emotionally and mentally?
Thanks, Dr. Oliver. I really appreciate the opportunity to be able to talk about the Brooklyn experience because it's been a very emotional time for us. In the beginning of the crisis, our positive COVID cases doubled every 3 days or so. Before you know it, we were a totally COVID hospital. And at the same time, our staff was getting sick too. In fact, we had about 36% of our staff, including the leadership, that was infected with COVID during the height of the crisis. But the nurses responded. They worked 4 or 5 or 6 12-hour shifts in a week. They managed increased patient loads, and they took on the sickest of patients that we've ever cared for. At one point, we had 51 ventilators in use where we normally have 3 to 5. There was, and still is, a considerable amount of anxiety and fear among the staff here in Brooklyn. And we are seeing it again, especially now as we plan for the next potential surge. It's a very human emotion, and the nurses stepped up despite that fear. They helped save lives, many lives, and I'm in awe of this team. How they persevered and delivered care that the community needed. Throughout it all, Brooklyn leadership and the system recognized these emotions, this fear and this anxiety, and they provided support in a variety of ways. The Office of Wellbeing and Resilience offered various opportunities to talk and acknowledge, and everyone's concerns were heard. Our recharge room remains fully functional to this day, and it is still used very often. I think many of the staff did not realize the full impact of their emotions until after the crisis abated. Recently, we participated in a program called Shared Stories, where staff were encouraged to speak freely about their experience and feelings and fears. And this program was so well received and very much needed. In Brooklyn, we will continue to keep looking out for the physical and mental health of our nurses and offer whatever support is needed. It is important. We owe so much to those who gave so much. Thank you.
Thank you, Claudia. Stacy, we focused a lot on the experience of our hospitals in New York City. What was your experience like at Mount Sinai, South Nassau, and Oceanside, Long Island? Being far from the city, how did you feel South Nassau was supported by the health system during COVID-19?
Thanks, Beth. As you've heard from all of the colleagues that spoke before me. We had so much support from the health system. Although we may be several miles from New York City, Mount Sinai South Nassau never felt alone. I never felt alone. None of us here felt alone. I had all of my colleagues whenever I needed them. I could pick up the phone whenever necessary. We were constantly communicating. And not just the CNOs, but across the system. You all know we had calls every single day, 7 days a week, multiple times a day. And on those calls, we were always asked, what do you need? Is there anything we can send to you? We got so much support, equipment, supplies, anything we needed from the health system. Really, it was extraordinary. And everyone here acknowledges that without the support of the health system, we never would have been able to succeed the way we did in Nassau County. We were really in the epicenter of the surge, and the patients were coming fast and furious, just as they were everywhere else. And we surged to capacities beyond anyone's imagination. It was really unprecedented. We were at 150% capacity, but our ICU went from a 22-bed, two 22-bed units, a total of 22 beds, to well over 90 patients, and hundreds of patients on ventilators. It was really extraordinary, the work that everyone did. And I would say, similar to Brooklyn, Mount Sinai South Nassau still has a community feel. The staff that work here live here. So it was really important that we supported the staff, and that the community, the outpouring from the community to the staff is really what helped. The staff here were so dedicated to helping the community, helping their neighbors. They were literally their neighbors. Some staff can walk here from their homes, and they just stepped up. They never once complained. They just kept offering advice and asking us what we could do and what they could do to make things better. We always made sure they felt safe to the best of our ability, and that was the most important thing. We worked tirelessly to keep our patients well cared for and our staff safe. And the community support really motivated the staff. They came and they did rallies, and they drove by and they had parades, and all of that was really, really important for the staff. And I have to say that it was an honor to work with the staff here. I had only been here just over a year when the pandemic hit, and the camaraderie, and I feel like such a part of this entire team. It's unbelievable. And being part of the health system really, really helped save us.
That's great. Thank you, Stacy. Fran, has the COVID-19, the pandemic led to many nursing innovations in nursing. Can you give us a few examples and how they've implemented really across the health system?
Dora, I have so many examples, as I know that the rest of our CNOs have. So I'm going to touch base on just a couple. And,
Sure.
We've all talked about that as the, pandemic surged here in New York and across our regional area, that we had a steady and quite quick influx of new, very acute care patients, and we had to open up new ICU units in very innovative ways. And that led to us needing to extend the RN to patient assignment in the ICUs because we had a finite number of nurses, and the patients were here. We needed to take care of them. So the team-based model of care was developed in mid-March, and all levels of nurses, as well as the Department of Education, put this team-based model together, and it became a very iterative process with improvements as it was rolled out. It was composed of pediatric nurse practitioners, RNs, PACU nurses, OR, and med-surg nurses who quickly learned how to support our ICU RNs. so that as their assignments were stretched, they had the support that they needed. And as Maria Vizina, in talking about lean, this was a way for us to really be able to standardize the practice across the specialties so that it could also be extended as our other sites were also using the team-based model. And what was really important about this too is that nurses across the hospital gained a real appreciation for each other and the work that we all do. And that lives on now as we're in recovery and going into our new normal. And another example is proning, the proning team. So proning, it's a specialized procedure that requires 6 healthcare professionals. And it's to improve air exchange for our patients who are in acute respiratory distress. So you can imagine, as we're already extending our RN to patient assignment, how then to come up with 6 providers on the unit, 6 healthcare professionals, including nursing, including the primary nurse, to train them to be able to then do what takes hours for the proning team collectively throughout a shift. So one of the cardiac nurse leaders came up with the idea, as it became obvious that our growing numbers of very acute COVID-19 patients would require proning, that we would organize a proning team. And they would travel across the hospital to prone patients instead of attempting to gather and train staff on each unit. And this was an interdisciplinary approach that ensured patients had immediate access to best care across the hospital in a standardized way, which was so important. And everyone agreed that this was put together very quickly, but very efficiently, with real attention to standardized competency and skill, and that it was a life-saving game changer. And another example, I'll give one more, if that's okay, is our care delivery, transformation, and dialysis. Now, many of the critically ill COVID-19 positive patients developed acute renal failure, requiring renal replacement therapy. So here we are, we're doubling our ICUs. This while we're including additional pumps, vents, and other equipment where there wouldn't be enough with one patient in the room, and now we have 2. How then can a dialysis nurse and the dialysis machine also fit into that room? It became impossible. So we needed to know that our nurses were within a short distance so that they could look at the access point and take good care of the patient. And this lasts for 4 to 5 hours. The nurses advocated for a system that would allow the dialysis nurse to virtually monitor the patient's vascular access, visualize the dialysis machine for clinical changes, and maintain the ability of the nurse to quickly respond to machine alarms and patient status changes during the dialysis treatment outside of the room. They provided their experience and their expertise to identify the needs. And what happened was the Touch Telehealth, it's an iPad delivery system, proved to be the answer. And this was configured within a couple of days once we came up with this, with the RN's feedback. They received training on it right away and got their login, and they were able to immediately use it. So this provided our nurses with the ability to safely monitor the patient and the machine outside of the room in real time, minimizing the amount of time required to spend in close proximity with the patient where there was not enough room. An additional advantage of the system was the ability it allowed the nurses to communicate and provide virtual preceptorship to redeployed and travel nurses and assist them in basic troubleshooting. These devices also proved to be a real lifesaver and game changer for the hemodialysis nurses. Thank you.
Thank you, Fran. Stacy, how has COVID changed your approach to driving improvements in patient experience at Mount Sinai South Nassau?
Well, thanks, Beth. So interestingly, through all the stress and all the anxiety, our patient experience scores for the first and second quarters rose significantly. The staff in many instances took on the role of family and really went above and beyond to meet the emotional needs of the patients and the families. We've all kind of mentioned this But we see it in the results, and that is pretty exceptional. We have a wonderful patient experience team, and with their support, we conducted virtual visits with families every single day. And the staff saw the value in connecting the patient and the family, and they were at the bedside doing the virtual visits with the family. It was really, really amazing. And that is a takeaway, you know, now and even still. And even with the limitations in visiting, we're really managing even that very well. We have a SharePoint site where the nurses or the case managers, who are also nurses, ask the patient to identify a caregiver that they want information shared with. We all know that we do this all the time, but we really hit home on this during the pandemic. And that person was listed and then contacted and asked what time each day they would like a phone call or a virtual visit. And we would put that on a SharePoint site, and somebody was assigned, if it wasn't the primary nurse, it was the care manager, somebody was assigned to make those calls and provide all those updates, so people felt that their family members were safe, the patients were safe. So that is something that we're continuing to do even now. We're really hitting home on the caregiver to make sure we have somebody to contact that we can share information with, especially with the continued limitations in visiting. And we too used Amazon Echo and iPads to help the patients stay in touch with their families. So we gave them their own if they needed it so that they could FaceTime. And we use the Echo in similar situations where to limit the exposure of the staff to the patient. So anybody, even now that's on any type of isolation, we can have an Amazon Echo at the bedside. It's an Echo show, so you can have that two-way face-to-face conversation with the patient at the nurse's station and understand what their needs are and help meet their needs. And these are all things that are really helping significantly to feel connected with the patients. And then the other thing that we still have our chaplains doing virtual visits. Many of our chaplains are volunteers. So they are working from home and they're doing virtual visits voluntarily from their homes. And then the last thing that I wanted to mention is the ED operations team doing callbacks. They were calling back every single patient. And what they've done now, they have a whole team that does this. And they are now identifying any patients that they felt were vulnerable to make sure that they really scheduled an appointment. If they need a referral, we are creating that service for them and referring them to the appropriate providers to make sure that they get the care that they need so they don't come back unless it's absolutely necessary.
All right, thank you. This question I'm going to give Stacy, if you want to start it, and then maybe we can punt it to Jill and everybody. We have 5 minutes left. Would love to hear everybody's thoughts on this. How did your leadership teams come through the height of COVID? And if there is a second surge, or if you had the opportunity, hopefully we never have to go back and do this all over again, what lessons? What are the lessons learned?
Well, I can't say enough positive and thankful thoughts about the leadership team that I work with here. And we really excelled as a team. We got together and we just really did whatever it took. They stepped up. I can't say enough. From a perspective of leadership, I would say the most important thing is to be as transparent and authentic as possible. It is the most important thing. Be out there and let everybody know exactly what you know. Share the facts as you know them. Tell them what you want to tell them, and tell them again. They need to hear it. They really do. And share any future plans with whatever we're planning for a potential wave 2. I think we need to get that information out to the staff in advance so they are just as prepared as we are.
Thank you.
Just to get it in there, I do have to say that we've had a broad spectrum of results from this crisis on my team. Of course, we all know that my leadership team was directly affected, and we did lose a member of our team. I do have to bring that here in memory of Caius Jordan Kelly, that served as our assistant nurse manager. But it strengthened us as a team. We really pulled together. We recognized the importance of really just standing strong And as Stacy said, being there and being emotionally involved with our staff and showing them that we too, feel all the effects of the crisis. So again, it just pulled us together. It affirmed the reason for us making the decision of joining this profession and really solidifying that we are a team.
Thank you.
I just want to say I would agree with my colleagues. I think communicating in real time and with transparency was the safest way for us to manage what we were going through at the time.
No, it just very quickly too, as we were going through the surge initially, the information was changing by the day. And we now have policies and procedures in place. We have very set communication, venues about how we communicate. I think the points being made about being very transparent, what we know and also what we don't know, but you'll know it as soon as we do, was very reassuring to staff. But we have a lot in place right now, should that happen again. Thank you.
And there's no such thing as over-communication.
Thank you.
I was just going to comment. I couldn't agree with my colleagues anymore, and I'm so full of pride. But I also want to say that never underestimate the boundless resilience that not only the people on this call right here now have done, but our frontline and the entire teams. There was just when you thought their tanks were empty, they all showed up again. And when you thought they were empty, they showed up again and again and again to do all of the things that we talked about. And if they got sick, they came back. And they all cared for one another. That's entirely, we didn't teach that. We didn't teach that. That's the people that we hire and the people that we are surrounded with have come with that. And just when you needed it most, it showed up. And I think you're right. Communicate, and more communication.
Yes. So in closing, just really want to thank my colleagues. I think that this was really, thank you so much for sharing. I think that we've all stressed, you did an amazing job, and you're right, the communication was essential. Your resiliency, the resiliency of our staff, we should all be so proud. So thank you again, and have a great day. Thank you.
Thank you.
Thank you.
Here comes the sun, doo doo doo. Here comes the sun, and I say it's alright.